Hello, I'm Tristan.
I'm Luke.
And I'm Maddie, and today we will be discussing a mental health condition known as factitious disorder. There are two variations of factitious disorder. These versions are differentiated by who initiates the induced symptoms. In factitious disorder imposed by self, an individual deceives medical providers by faking the symptoms of a physical or psychological condition. Their primary goal is to adopt a sick role and gain attention from others, so they create physical impairments on their body or pretend to have a mental health condition. Overall, the individual's own actions contribute to the severity of their condition. In factitious disorder by proxy, the method in which they received impairment is not self-induced. The actions of another are responsible for the circumstances and conditions felt by the affected individual. In this case, the individual creating symptoms on another, not the victim, would be diagnosed with factitious disorder.
DSM criteria. The DSM-5-TR criteria for factitious disorder by proxy and factitious disorder imposed by self are as follows. 1. There is falsification of physical and psychological symptoms or induction of injury and illness with a known deceptive nature of their creation. The deception and manufactured symptoms are not contributed to the potential of an external reward like money, or this condition cannot be better explained by another disorder. There is one difference in DSM-5-TR criteria for factitious disorder by proxy and factitious disorder imposed by self, which is indicated by the stars on the slide. In factitious disorder by proxy, an individual presents another individual as sick or injured. Relationships between mothers and children are the most common for factitious disorder by proxy. Mothers will force their children to display physical or psychological symptoms to gain sympathy and attention from others. In factitious disorder imposed by self, the individual presents themselves as sick or injured.
Prevalence. Factitious disorder is a relatively rare diagnosis in our society, but the limited population of individuals diagnosed have some similar attributes. Around 1% of all people admitted into the hospital are diagnosed with factitious disorder. In general, this percentage is underestimated because a substantial majority of people have not been admitted into the hospital for extended periods of time. The actual prevalence within society is likely more than 1% when considering individuals receiving care at outpatient clinics. Most individuals diagnosed are female, and the age of diagnosis usually lies within individuals from 30 to 40 years old. Factitious disorder also has a high comorbidity rate. Most patients diagnosed with this condition likely struggle with substance disorders, personality disorders, mood disorders, or anxiety disorders. It's time to review what you have learned about the diagnostic criteria and prevalence of factitious disorder. When diagnosing patients, which of the following is a defining feature of factitious disorder by proxy? Pause the video and give yourself a moment to answer. Once you've decided on your choice, continue the video to check your results. The correct answer is C. A patient propagates symptoms in their child. In this example, the question refers to factitious disorder by proxy. The key element to this question is that the symptoms are placed onto a separate individual. This relationship often occurs toward individuals closely related to the patient, such as children. If this is still confusing, rewind the video to the section explaining the DSM-TR5 criteria to differentiate the variations of factitious disorder.
Factitious disorder has interesting and repetitive signs that can help lead to potential diagnosis. These warning signs are present in both variations of this condition. Warning signs can be observable at appointments within healthcare providers as well as in social settings. The first major warning sign within healthcare settings is a patient with an inconsistent medical history. Patients with factitious disorder often use various methods to convince others they are sick and gain attention. The conditions these individuals inflict on themselves or others can often vary over time. Afflicted individuals present a wide variety of conditions along with other suspicious factors. There can be unnatural spikes in diagnoses or reappearances of conditions that were previously considered treated or cured. Similar to variations in medical records, another sign of factitious disorder relies on another portion of their care plan. Individuals often receive different treatments from a variety of hospitals and other healthcare settings. A final healthcare specific warning sign includes patients who are abnormally eager or willing to undergo extensive medical procedures. While the average individual likely dreads a trip to the doctor's office, people with factitious disorder hope to experience stimulation or other side effects from surgery, medications, or injections. A major warning sign in social settings is the inconsistent presentation of symptoms. Patients with factitious disorder are observed exaggerating and prolonging their symptoms. However, when the observer leaves the room, these symptoms are miraculously less impactful. Another warning sign of factitious disorder is if a patient appears hostile when the validity of their symptoms is questioned. If the patient under observation is tested and the results for a medical condition appear negative, they will likely become aggravated or doubtful. Finally, another clue that an individual could be afflicted with factitious disorder is if they strongly disagree with their physicians communicating with their family members. Family members may be unaware of their potential illnesses or extreme injuries. By limiting this interaction, the likelihood that healthcare providers learn the truth about their symptoms is reduced.
Symptoms and behaviors. Various symptoms regarding presentation to others and medical professionals are on display in people affected by factitious disorder. Cutting oneself, ingesting poison, overdosing, and changing the results of self-administered medical tests are ways these patients can deceive healthcare providers and their peers. These harmful behaviors are commonly correlated to suicidal ideation, negative self-perception, and the desire to receive affection from others. It's time for another review question. Which of the following is not a warning sign of factitious disorder? Pause the video and resume once you have your answer from the choices below. The correct answer is B. A patient allows the physician to consult their family members when asked about their condition. This response contradicts information on the warning signs for factitious disorder. Patients commonly discourage their physicians from receiving additional insight into their alleged conditions.
Causes and risk factors. There are numerous experiences that could lead to the development of factitious disorder. Consequently, they all relate to childhood experiences. Social isolation, physical or emotional abuse, neglect, and other traumas increase the likelihood of developing factitious disorder. These children may feel a longing for the compassion and attention, which is why they cause harm to themselves or others to appear sick. Children who witness their loved ones suffer from a chronic illness are also likely to develop this disorder. They may become jealous and believe that their loved ones are idolized because of their condition.
One well-known case of factitious disorder by proxy involves Gypsy Rose Blanchard and her mother Dee Dee. Although she had no true medical conditions, Gypsy Rose was forced to undergo numerous procedures as authorized by her mother. Her parotid glands were removed to produce excessive drooling, she was confined to a wheelchair, and she had a PEG tube for feeding. She was forced to sleep with a CPAP machine also. No one knew of Dee Dee's deceptive behaviors, including her estranged father, so she was able to receive Make-A-Wish and Habitat for Humanity donations to care for her daughter. Dee Dee also falsified Gypsy Rose's birth date, making her appear 4 years younger. Gypsy Rose was led to believe she was sick throughout her childhood. The abuse ultimately ended after a successful homicide attempt on Dee Dee, which was orchestrated by Gypsy Rose and her online boyfriend.
Treatment. Due to its peculiar nature, there is no known treatment for factitious disorder. Healthcare providers often do not know if their patient is truthfully experiencing an uncontrollable disorder, which is why it is difficult to diagnose. Patients often resist discussing their condition with extensive detail, for they may be worried about making an error in their explanation. There are also no current diagnostic lab tests to determine if a patient has factitious disorder. The best recommendation for treatment is the use of psychotherapy. The main goal is to better understand the underlying mental health issues a patient is experiencing. Family therapy is also used to support patients with a greater social network. If the patient is also diagnosed with other disorders, such as generalized anxiety disorder or depression, medications can be used to alleviate symptoms. However, this can be a challenge because one behavior of factitious disorder is overuse of medications.
Ethical implications. There are several ethical implications that patients with factitious disorder create for medical professionals. First, patients often do not consent to their new medical providers accessing their previous records. If a physician believes that their patient may have factitious disorder and attempts to read their medical history without consent, then their career is at risk. This dilemma within healthcare has contributed to the climate in healthcare today, where access to clinical notes is heavily guarded. Medical providers who eventually diagnose their patient with factitious disorder can also be subject to medical malpractice. This would occur if patients genuinely possessed a medical condition and are misdiagnosed. Access to healthcare can also be delayed for patients who are truly ill, for their spots on wait lists for certain procedures are taken by those with factitious disorder. Identity switching, such as using a fake name to receive medication, could negatively impact those presenting factitious disorder and the community around them, which was shown in Gypsy Rose's case. Healthcare providers will have trouble gathering information on their patient if they are not found in previous databases.
To protect patients with factitious disorder, certain guidelines must be implicated for medical professionals. Informed consent, patient respect, professionalism, and confidentiality are necessary to ensure career safety and proper implementation of care. There must be interdisciplinary meetings between healthcare centers to discuss the treatment of a patient and determine the progression of their condition. Collaboration between medical providers can further uncover abnormalities in a patient's condition and determine if they show signs for a factitious disorder. Medical professionals can ensure proper patient care and advocacy when they offer educational services to family members of a patient with factitious disorder. They must maintain a holistic approach and offer emotional support to help patients with factitious disorder recognize the severity of their condition. Finally, it is essential that healthcare workers show the compassion towards their patients. Despite the presentation of actual or manufactured symptoms, the priority of care should be based on a patient's well-being. Building trust with the patient is necessary to gain more information on their childhood experiences, uncover other mental health issues besides factitious disorder, and cooperate with the patient on their future treatment. This will be our final review question. Which of the following is a challenge healthcare providers face when diagnosing factitious disorder? Pause and then resume once you've selected your answer. The correct answer is D, all of the above. The willingness of patients to access medical records, lack of specific lab tests, and risk of making false accusations are challenges for healthcare professionals concerning factitious disorder.
Future considerations. It is difficult to spread awareness about factitious disorder because of its low prevalence rate. However, healthcare providers should be aware of this disorder when reviewing a patient's symptoms and providing treatment. We propose 2 future questions about factitious disorder. 1. How can artificial intelligence be used to detect symptoms of factitious disorder? And what is the most effective way to create training programs for medical professionals to detect factitious disorder? With the rise in virtual appointments, we wonder whether artificial intelligence could be used to detect changes in speech or facial expressions when patients discuss their condition. We also wonder whether factitious disorder could be effectively introduced in medical school courses or if training programs could be offered in healthcare facilities. How can healthcare providers learn to trust their patients, but also be aware that their patients may be falsifying symptoms?
Conclusion. Our research on factitious disorder has allowed us to draw the following conclusions. Factitious disorder is a serious medical condition, is currently underrepresented, and poses as a threat toward healthcare access for other patients, creates ethical dilemmas for medical professionals, and is difficult to diagnose due to a lack of diagnostic lab tests and deceptive behavior of patients. Individuals pursuing healthcare careers must be aware of factitious disorder and its potential implications. This disorder ultimately emphasizes the importance of not only protecting the safety of patients, but also the safety of healthcare workers.